Kama njia moja ya kuongeza idadi ya wauguzi katika ukanda wa mashariki mwa nchi na nchi nzima kwa ujumla, hospitali ya PCEA Chogoria kupitia chuo chao cha mafunzo ya utabibu na sayansi CIC wamezindua ujenzi wa jumba hili ili kuongeza idadi ya wanafunzi kwenye chuo hicho na pia kupanua zaidi chuo hicho. Daktari Elijah Mwaura ni afisa mkuu wa hospitali ya PCEA Chogoria.
He's over 40 years old, and for those 40 years we've been concentrating on training nurses. What we have discovered in the last few years is that Kenya now doesn't just need nurses, it needs more. We need to create more workforce for the healthcare industry, and there's a great need for other cadres to be trained, and therefore we have started training other diplomas in perioperative theatre technology. We also have health records training here, and we are also going to offer a higher diploma in nephrology here. And therefore our school has grown. Even the nursing students themselves, they have also increased. And so with the increasing number and the increasing need, there's need for growth in infrastructure, and that's where we come in today. Our partners from the US, that is MBF, and of course the source of the grant, which is the USAID, they have come in to help us because the cost of infrastructure it's a great cost. It comes at a great cost, and unfortunately you can't grow a college. Not say like Corona came without anybody knowing that it was going to come and be a pandemic so quickly, and there was no time to train nurses. So now the world knows that we need to be ready in future. Should anything like Corona come, we need to have not only enough nurses in our institutions, but we also need to be able to have a way of producing more and quickly. And that's not just nurses. I'm mentioning nurses because they are the core of healthcare. That's where we come in as Clive Irving College of Health Sciences. We are striving to make an impact in this country, because our quality of training is well known. It's not, we don't accept just standard nurses, we want excellent nurses. Chogoria Hospital, the vision is to be a regional leader in specialized healthcare and training. Those are the two things. So we're talking about specialization and training. Training is like part of us, because the impact we want to make is beyond Chogoria. And that vision, of course, comes from our owner, who is the church, the PCEA church. And so all this we are doing is to the glory of God, because we are producing healthcare workers who go beyond healthcare, you know. We have a greater mission, wholesome care of a patient. We take care of the spiritual and the physical aspects of a patient. That's what we are trying to train our people. And so if we can have these people not just work in Chogoria, but work in government, work in private places, we'll make a bigger impact in the world.
Kauli yake ikiungwa mkono na Jameson Kithiji, mwalimu mkuu wa chuo cha CIC.
Wauguzi hapo wale ambao tunaita nurses ndio wanakuwa wengi kabisa kwa hospitali, na itakuwa jambo la busara sana kuweza kuwapea mafunzo ya hali ya juu, na pia tuweze kuongeza zile namba ambazo zinaweza kutoka kwa shule za kusoma, ndio tuweze kuhakikisha jamii yetu iko na watu wa kutosha, na ndio bado tuweze kuchunga wagonjwa kwa mahospitali zetu, na tuweze kuhakikisha afya ya watu wetu imeweza kushughulika.
Ensure that we continue with the training of healthcare workers so that we can be able to bridge the big deficit of healthcare workers in Kenya. We commit to train more. We commit to train to the highest quality, and it will not just be for our glory, but ultimately to the glory of God.
Ujenzi wa jengo hilo umefadhiliwa na shirika la MBF kupitia USAID ya Marekani.
Mayo, I'm the president and CEO of MBF. MBF and USAID have been in partnership for many years in many different countries around the world. USAID in this particular project has a specific focus on both healthcare and education. So educating nurses is the perfect combination of those two things. You're both improving education as well as improving healthcare. He didn't mention it, but the goal of the nursing school is 1,000 new nurses in Kenya by 2030. 1,000 new nurses. That's enough for one big hospital or a couple of hospitals. So that's why USAID is very interested in sponsoring this, is because it's going to make a significant impact.
If we have limited resources and we want to put those resources, particularly right now in 4 countries, and it's Kenya and Malawi and DR Congo and in Haiti, then we have to decide, how do we help the nurses? The first thing we do is we want to make sure that you get every opportunity to get a quality education that you can then use to serve your community. And so that's what our board is dedicated to do. That on our heart as our mission of MBF, to find ways so that you can deliver quality health care in this community and make this a sustainable hospital that will continue to not only provide the best service for the community, but will continue to add, as Andy said, more than 1,000 additional nurses to care for your people.
Gilbert Mutebei ni mwenyekiti wa bodi simamizi ya hospitali hiyo.
Really, we are just excited. We will spend each and every coin will be taken care of, and actually we believe that in the next 10 years we are going to see a different hospital. We are going to keep on seeing the patient experience will be exciting. We are going to train a lot of personnel, and we are also going to contribute to the health sector in Kenya. The hospital, when you see the physical facilities, those are only the hardware, but the software is good. The software, we can be able to assure everybody the software is good. We have got specialists who are here. We have got specialist nurses. We have got the hospital care is actually top notch. And we are promising that, and this is the staff, and we are really working towards making it the international standards of care.
Chifu wa lokesheni hiyo amesifia manufaa ya hospitali hiyo katika eneo analosimamia.
Government, we have been working together. I don't know whether Dr. Deborah is here. The mental health and counseling department. The moment we started the war against illicit brews and drugs, that department has been of great use. The institution has been of great economic value to the community. And when I see such buildings coming up, it's of great.
Wanafunzi pia walishabikia pakubwa upanuzi wa chuo wanachokitegemea.
We are going to be equipped. We are going to give more, to earn more knowledge. We are going to assist the society to provide patient care, the nursing care that will be available to the society, and this will help the community to grow and even to expand the healthy sector in our country and even globally. So we are happy because of that.
Langu jina ni Wajomeka Machu.